or good day everyone. So today we will be discussing a different radiographic projections performed for digits in your under your upper extremities. So before that, we will also be discussing basic anatomy of your upper extremities. Okay, so let us start. So upper extremities consist of 64 bones. So these 64 bones are divided into four main groups: the hand and the wrist, the forearm, the arm or your humerus, which is attached to your shoulder, and then the shoulder girdle. So these are the four main groups that comprise your upper extremities. So, let us discuss why is it na 64 siya overall. So, the hand first, or the medical term for hand is manus. So, there are 27 bones which are subdivided into the following groups. So, there are 410 phalanges, or in English, it's phalanges. So, it includes the bones of the digits, which are the most distal. The digits or your fingers are the most distal of the bones of the hand. So we will be discussing the upper extremity from the distal to the proximal part of the upper extremity. Then we have metacarpals, 5. So this comprise the bones of the palm, and their carpals, which is 8. So this comprise the bones of the wrist. So this 14 plus 5 is 19 plus 8. This is 27. 27 for one hand or one manus. So if you are a normal person, you have bilateral. When we say bilateral, both or two. When you have left or right hand, the total number of bones for your both hands, left and right, is 27 plus 27. That is 54. Okay? So as I mentioned earlier, we have a total of 64 bones. So later, we will be discussing if saan nanggaling yung 10. Okay? So dito na we have 54. So 27 for each hand. So for arm, we have 2. 2 for each arm. So we have the radius and the ulna. So we have 4. So 2 for each hand. So the radius and the ulna, we will be discussing that also as we go along. Then we have the arm. So we have 2. So 1 each. So your left and right forearm. Then we have the shoulder girdle. So let us see if how much or how many. So actually there are 4 in total also. So 2 each. So as we go along, we will discuss what comprises these bones of your forearm, the arm, and the shoulder girdle. So basta 64 sa. So we will now focus on this 54. But this afternoon, we will be discussing only the hand and wrist, and also we will be focusing specifically sa examination sa digits. Okay? So here we have the fourth and phalanges. So we have here, so bones of the digits, which are the most distal. So these are the digits. We have 5. So 14 siya. So this is your thumb, is your first digit is your thumb. Then second will be your what do you call that? Index finger. So index, and then your third is your middle finger. Then fourth is your ring finger, and your fifth digit is your pinky. It's a small one. So we number this from 1, 2, 3, 4, 5. Okay? So why 14? So for digits, so sa first digit, we only have one phalanx. So if singular, it is phalanx. If plural, we call that phalanges or phalanges. So again, there are two phalanges for the first digit, 1 and 2. For the second, third, fourth, and fifth, we have three phalanges each. So we have 1, 2, 3, 1, 2, 3. So therefore, we have, allow me to erase this muna. So we have three phalanges, 3, 3, 3. Then we have 2. So 3, 6, 9, 12, 14. Okay? So you again, remember your first digit, which is your thumb, has only two phalanges. The distal and the proximal phalanx. Distal, proximal phalanx. While your second, your third, fourth, and fifth digits, they have three phalanges. They have the distal phalanx, the middle phalanx, so, and the proximal phalanx. Again, for the first digit, we have distal and proximal phalanx or phalanges if we are talking about two of them. If distal lang, distal phalanx. For the second, also third, fourth, and fifth digits, they have three phalanges. So they have the distal, they have the middle phalanx, and the proximal phalanx. Okay? That's why, again, we have a total of 14 phalanges for each hand. So, assuming you have a normal hand. Walang labis, walang kulang. So, therefore, for both hands, left and right, we have a total of 28 phalanges for both hands. So, again, we are talking about normal hands. So, yung mga walang extra or walang kulang. For metacarpals, we have 5. So, ito yung ating metacarpals. So, 1, 2, 3. Ay, mali yung pagka-count ko. Teka. So, dapat pag-count, nagsisimula sa thumb. So, 1, 2, 3, 4, 5. Okay, so we have 5 metacarpals. So, for both hands, of course, we have 10 for both hands. Carpals, we have 8. These are the carpal bones or your what comprises your wrist. So 8 for each hand, 16 for both hands. Okay, so I hope that is clear. So we will talk about the digits. So again, it contains a total of 14 phalanges, as I have mentioned. These are long bones that contain a cylindrical. So ang Ang shape niya is parang cylinder and articular ends which comprise or which have the head and the base. So the digits have head and the base. Actually, tatlo siya. My head, body, and base. So later, I will show you a picture of that. And there are 12 phalanges that have two articular ends. And the first digit, as I have mentioned earlier, has two phalanges, the proximal and the distal phalanx. So, since it is called a proximal phalanx, so therefore they are closest to the palm of your hand. So if you can recall the proximal and the distal for directional terms that we have discussed during the prelim period, so proximal is near or closest to the point of origin. So our hand, our digits are attached or articulated to our palm. Of course, this is called the distal because it is far from the palm of the hand or far from the origin. Distal phalanges are small and flattened with a roughened end, and this gives them a spatula-like appearance. So ito yung ating distal phalanges, this one. So parang spatula daw yung kanyang itsura. Spatula-like. So they are roughened and flat siya. If you can check your digits now, your distal phalanges, you look at it. So they are like flat ends, flat rough ends. And it looks like if the bones are examined, they look like a spatula. So the five digits have 14 phalanges, and the other name for thumb is pollex. For the big toe, which we will be discussing sa next discussion sa lower extremities, big toe is referred to as the hallux. The thumb, medical term is pollex. The big toe is hallux. So I have mentioned this earlier. The second digit is your index finger. Third is your middle finger. Fourth is your ring finger. And fifth is your pinky finger or your little finger. I also mentioned this earlier that the thumb or the first digit has only two phalanges, the proximal and the distal phalanges. While for the fingers, which are the second, third, fourth, and fifth digits, there are three phalanges, the proximal, the middle, and the distal phalanges. Okay? So these are the digits again for a clearer view. So allow me to erase the writings. So again, we start from the thumb. This is your first digit, second, third, fourth, fifth. So this is the digit until here. So we have the proximal, the distal and the proximal phalanx. Then we have the distal, the middle, and the proximal phalanx. The same is true for here. So distal, middle phalanx, and the proximal phalanx. So siya. Then this one, so we have 1, 2, 3, 4, 5. These are your metacarpals, which comprise the bones of your palm. or yung palad. And then your wrist, so we have 8. So comprise your bones of the wrist. They are attached to the radius, and this is the ulna. Then for metacarpals, so meta meaning beyond or after. So after your carpals. So other term for carpals is carpus. So they are cylindrical in shape and slightly concave anteriorly. So parang concave siya. So yan yung shape ng inyong palad or your palm. It articulates or they articulate with the phalanges, or they are connected with your phalanges at their distal end. Distal end of your metacarpals. The distal end of metacarpals are articulated with the proximal ends. So I will write it here. Distal end of metacarpals are attached or are articulated or attached to the proximal phalanx or phalanges. So MCP or your metacarpals, so at their distal end of the metacarpals, and they articulate with the carpals proximally. So ang distal end ng metacarpals are attached to the proximal phalanges. And then the proximal part of or the proximal end of the metacarpals. So MC metacarpals or sa ibang book MCP. So the proximal part of the metacarpals articulate or attach to the carpal bones or carpals. They form the bony framework of the palm of the hand, and they are also long bones just like your digits, consisting of a body and 2 articular ends. The head is distal, the base is the proximal part of your metacarpals. The head of the metacarpals are commonly known as your knuckles. So ito siya, yung head is the distal portion. Then yung base, ito yung proximal portion. Ito yung naka-articulate sa carpal bones. Ito yung knuckles. Kapag you form your hand into a fist, yung parang manununtok ka, yung naka-usling bones doon, we call that the knuckles. So they are the head of the metacarpals. So they are numbered 1 to 5, which begins from the lateral side of the hand. So if you can remember, if you can imagine your anatomic position, di ba, your thumb is on the lateral side. So thumb is on the lateral side. So when we are referring our base or baseline sa ating anatomical position. So just like our digits, so the first digit is your thumb. So, dyan din naka-attach yung ating first na metacarpal bones. Sorry for that. So, the first metacarpal bone is attached to your trapezium, which is a part of your carpal bones. So, later I will show you a picture of that. Second metacarpal bone is attached to the trapezoid. Third metacarpal bone to your capitate. and your fourth and fifth metacarpal bones to your hamate. So trapezium, trapezoid, and trapezium, trapezoid, capitate, and hamate are the distal portion of your carpal bones. So ito. So these are the distal portion of your carpal bones. These are your proximal carpal bones. So as you can see here, your first digit is attached to your trapezium. Second carpal bone, sorry. First carpal bone, sorry, erase, sorry. First metacarpal bone, yon. First metacarpal bone is attached to your trapezium. Your second metacarpal bone is attached to your trapezoid. Ito, siya. Your third metacarpal bone is attached to your capitate. Ito. And your fourth and fifth, they are both attached to the hamate. Okay? So we will be talking also about the different joints of the hand, which we will be using these terms as we go along with our examinations sa digits, sa wrist, sa hand. So we have this para mas maintindihan. So later, when I say IPJ, it is interphalangeal joint. Ito siya, yung joint. So, interphalangeal joint, meaning between the phalanx, between the proximal and the distal phalanx, or between the proximal or the middle phalanx. Ito, interphalangeal joint. Specifically, so they can be termed as pip joints. So minsan, if you're going to listen to lectures, to reviews, so pip joints. Sorry. We have the deep joints, JTS. So meaning that is proximal interphalangeal joint. Ito siya. Kinoconnect niya yung proximal phalanx to the middle phalanx. Or, in this case, kinoconnect niya ito din, proximal phalanx and the middle phalanx. So ito, kinoconnect niya yung proximal phalanx sa distal phalanx. Then we have the distal interphalangeal joint. So ito siya. Kinoconnect yung distal phalanx sa middle phalanx. Ito din. Okay? So also we have here the MCP joint. So MCP is metacarpophalangeal joint. So meaning this connects the metacarpals and the phalanx. So we have here the metacarpals. Ito siya, metacarpal connected to the phalangeal joint. Phalanx, sorry. Metacarpal connected to the proximal phalanx. So this is the metacarpophalangeal joints or the MCP joint. Ito din, the second metacarpal bone is attached to the proximal phalanx of the second digit. So between this is the metacarpophalangeal joint. Okay? Or specifically, we have the first MCP joint if we're talking about the first digit and the first metacarpal. So how about this one? What do you call this joint? So this is 1, 2, 3, 4. This is the fourth metacarpophalangeal joint. Or if we are talking about this joint, this is the fourth proximal interphalangeal joint. If you are talking about this one, this is the fifth distal interphalangeal joint. Okay, so I hope that is clear. Then we also have the CMC joint. So CMC, carpo-metacarpal joint. So it means that we are connecting the carpal bones and the metacarpal bones with a joint. So eto siya, this portion here, this is the CMC joint. It connects the metacarpals, ito yung metacarpals natin, to the carpal bone. So we have here the first CMC joint. So the same is true here. We have the second, ito, second CMC joint, third CMC joint, fourth CMC joint, and fifth CMC joint. So I hope that is clear. Okay? Okay, so let's proceed. The next we will discuss the carpal or the carpus. So it has we have 8 carpal bones for each hand. So a total of 16, as I have mentioned earlier. Then we have uh, ellipsoidal or condyloid type of joint. So our carpal bones, ang shape niya, appearance niya is like ellipsoidal or condyloid type. So later may picture or nakita nyo naman kanina yung shapes nila. So they comprise the bones of the wrist. So it is customary or it is normal or usual to name the proximal and distal row first, beginning at the thumb side. So again, when we count for the bones sa hand, so we start sa side of the thumb. So again, we have here the distal. Ito ang distal portion. Apat. Then, apat din yung proximal. So, if we're going to number them, we start from the thumb side. So, first, second, third, fourth, fifth, sixth, seven, eight. Okay? So, that's how we normally number our carpal bones. So, for example, if I say, what is the seventh carpal bone? So, it is trapezoid. Or what is the fourth carpal bone? So, it is the pisiform. Or what is the first carpal bone? It is the scaphoid. Okay? How about the sixth carpal bone? So it is the capitate. So I hope that is clear. So as you can see, their shapes are ellipsoidal or condyloid shape. So to easily memorize, to help you memorize, so again, so I have discussed here, I have discussed. So I have here a picture of your carpal bones. So again, we have the carpal terminology conversion. So these are the other names of your carpal bones. So sa proximal bone, so we have 4. Then sa distal, we have also 4. So this is 1, 2, 3, 4, 5, 6, 7, 8. Actually, dito tayo dapat mag 6. So, I 5. Teka. I'll erase the numbering. I'll make it clear. So we have 1, ito na lang, 1, 2, 3, 4. Then we have 5, 6, 7, 8. So the other term for scaphoid bone is navicular carpal bone. Lunate is semilunar. Trichitrum or triquetral or cuneiform or triangular. So other term siya ha. Then pisiform, this is the only carpal bone that has no other name. Wala siyang ibang name, ang pisiform. Then for the trapezium, greater multangular, trapezoid, lesser multangular, capitate is your os magnum, and hamate, the other term for unciform. Okay, so I hope that is clear. So we will discuss the four proximal carpals first. So we have the scaphoid, the lunate, the triquetrum, and the pisiform. So for scaphoid, this is the largest bone in the proximal carpal row. So largest in the proximal. Pero when we say largest carpal bone, it is the capitate. So again, pag sinabing what is the largest bone in the proximal carpal row or what is the largest proximal carpal bone, that is scaphoid. But if I ask what is the largest carpal bone, it is capitate. Okay? So this articulates with the radius proximally. So this is attached to the radius. It can be palpated near the base of the thumb. So malapit siya sa base ng thumb. So pwede mo siyang mapalpate. So other term as I mentioned is navicular. And scaphoid is the most frequently fractured carpal bone. Okay, so ilang beses na rin itong lumabas sa board exam. What is the most frequently fractured carpal bone? So it is this scaphoid. So again, as you can see, here we have the scaphoid. So this is the largest proximal carpal bone. Pero pag buong carpal bone, yung pinakamalaki talaga is your capitate. Okay? So your scaphoid, ito, is attached or is articulated with your radius. So ito yung ating scaphoid. The next for lunate. Lunate, from the word luna or moon. So it is crescent shape or half moon shape. Also referred to as the semilunar carpal bone. Articulates also with the radius, just like our scaphoid. So it also attached, it is the second carpal in the proximal row. So remember our numbering earlier. So the first is the scaphoid, second carpal is lunate. Also articulates with the radius and capitate distally. And lunate is best seen in AP projection. So if you want to visualize the lunate, which is a part of your carpal bone, so the best projection for that is AP projection of the carpal bones or your wrist. So this is placed between the scaphoid and the triquetrum. So we have here your lunate. Ito yung lunate. By the way, balik tayo. Parang mali yata yung na-circle ko kanina. Doon sa... So, ito pala yung scaphoid O, tama. Ito yung scaphoid. So, ito yung pinakamalaking carpal bone sa proximal row. Pero kapag again, pag buong carpal ang pinag-uusapan, mas pinakamalaki sa kanila yung capitate. So, ang ating scaphoid is attached sa radius. Yung lunate natin is also attached sa radius and also attached sa capitate sa taas. Ito. So, let's go back sa lunate. So, attach sa radius and sa capitate distally. Ito, attach siya sa radius, then attach sa capitate distally if proximal sa radius, if distal part sa capitate. So, it is placed or lies between the scaphoid and the triquetrum. Okay? So, ito yung triquetrum. Ito siya. So, nasa gitna ang lunate, nasa gitna ng scaphoid and ng triquetrum. So, next is the triquetrum, also called triangular carpal bone. It is roughly pyramidal and articulates with the hamate. So, it is attached to the hamate. And it is the third carpal bone in the proximal row. So, it is attached to the pisiform anteriorly. And nasa ulnar side naman siya ng wrist. Ito yung ating radius. Ito yung ating ulna. So, yung ating triquetrum, dito siya na side sa ulna. So, it articulates with the hamate anteriorly. Ito, attach siya dito sa hamate. So, it is the third carpal bone. So, again, we have 1, 2, 3. And next, pisiform. So, pisiform, it is a P-shaped bone which is located anterior to the triquetrum and is easily palpated. So, ito yung kapag nakaprone yung hand nyo sa ulnar side, so merong projection na bone that is your pisiform. Pisiform is the smallest carpal bones. The largest carpal bone is capitate. The largest proximal carpal bone is scaphoid. So triquetrum articulates anteriorly as seen on a carpal sulcus or tunnel view. So mas makikita yung ating pisiform when we perform a tunnel view of the wrist, especially for patients with carpal tunnel syndrome. So pisiform, aside from being the smallest, it is also the most anteriorly located carpal bone. Again, as I mentioned, the only carpal bone with no other names. Ito yung ating pisiform. Ito siya. So, madali siyang mapalpate. So, kapag tiningnan mo yung sa ulnar side, yung may projection doon na bone, that is your pisiform, the smallest. Then, we will talk about the distal carpal bones, which include the trapezium, trapezoid, the capitate, and the hamate. So, other term for trapezium is greater multangular. It lies on the radial or thumb side of the wrist. So, sa radius din, katulad ng scaphoid. Then, the tubercles. So, if you can remember your tubercles, these are the projections. The tubercles of the trapezium and scaphoid comprise the lateral margin of the carpal groove. So, there is a carpal groove. So, it is comprised of the tubercles of the trapezium and the scaphoid. So, trapezium is between the scaphoid medially and the first metacarpal distally. So, we have here the trapezium, ito siya. So, it is articulated with your scaphoid, ito, and your first, ito, CMC joint. Sorry, this is first MC joint. Ito pala yung mali ah. Teka. So, first CMC is carpo-metacarpal joint. This is the carpo-metacarpal joint. Tama. Ito. So, carpo-metacarpal joint. So, meaning we are articulating the carpals and the metacarpals. Ito yung ating metacarpals. Ito. So, next we have the trapezoid. So, the lesser multangular. The smallest distal carpal bone is trapezoid. The smallest carpal bone, if hindi na-mention yung distal, the smallest carpal bone is the pisiform. But if we say the smallest distal carpal bone, that is your trapezoid. So it is placed between the trapezium and the capitate. Okay, so we have here the trapezoid. So, a greater multangular ang trapezium dahil malaki siya compared sa trapezoid. Trapezoid is the smaller or lesser multangular. So, it is placed between the trapezium and the capitate. Ito, napapagitnaan siya ng trapezium and ng capitate. The smallest distal carpal bone. Then, for capitate, other term is os magnum, which is, as I have mentioned, the largest carpal bone. It is also the keystone of the carpal arc. So, ito yung pag sinabing keystone, ito yung main na attachment niya. Ito yung important foundation ng carpal arc. So, kapag ginawa natin, nag-arc tayo ng ating wrist, so that is because of the capitate. So as you can see, the capitate is placed at the center. Ito siya. So the most centrally located carpal bone, so at the center, articulates with the base, ito yung base ng third metacarpal, and lies between the trapezoid and the hamate. Then last, for the hamate, also called the unciform, this is the last carpal in the distal row. Pero again, if you're going to number it, this is the this is the fifth. Fifth siya, after the pisiform. Just like what I have numbered earlier. So it has a hook-like process or appearance. It lies on the ulnar side of the wrist. Siya sa ulnar side. So we have here the hamate sa ulnar side, pero hindi siya attached directly kasi naka-attach siya dito sa ating triquetrum. So ulnar side lang. The hamate and the pisiform form the marginal margin of the carpal groove. So kanina, the scaphoid, isa na yun. So trapezium and scaphoid, lateral margin. Okay? So lateral margin siya of the carpal groove. 'Di ba? Again, you have to recall your lateral and your medial. Okay? So again, we are basing this on our anatomic structure or yung ating ah, anatomical position. So, if trapezium and scaphoid forms the lateral margin of the carpal groove, the hamate na yan, and the pisiform form the medial. This is not marginal. Sorry. This is medial. So, this is the lateral side. This is the medial side. So, yung groove dito is formed by the hamate and baligtad yata. Scaphoid. Oh, baligtad yung label ko. Wait lang. So, ito yung lateral. Ito yung medial. So, scaphoid and trichitrum. Sorry, scaphoid and trapezoid. Sorry. Scaphoid and trapezoid. Trapezium, I mean. Trapezium. So, scaphoid and trapezium form the lateral carpal margin. Ito yung groove dito. Or the carpal margin groove or the carpal groove. Lateral carpal groove. While the hamate, so hamate and the pisiform, this one, hamate and pisiform. So they form the medial carpal groove. So hamate and pisiform medial, scaphoid and trapezium lateral. So we have discussed na the digits, the metacarpals, the carpal bones, and the different joints of the hand. So I have here mnemonics for you to help you memorize, to help you recall your carpal bones. So again, based on our carpal bones from proximal to distal, so we have scaphoid, lunate, triquetrum, pisiform. Then sa distal, we have trapezium, trapezoid, capitate, and hamate. So scary lovers try positions that they can't handle. So scary lovers try positions that they can't handle. So it represents a scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. I also have another mnemonics here. So long to pinky. Here comes the thumb. So if you can remember my numbering earlier, so we have here 1, 2, we have 1, 2, 3, 4, 5, 6, 7, 8. So ito iba yung pagkaka-number niya. Nag-start naman siya dito sa 5, 6, 7, 8. So ito naman, based sa numbering natin kanina, so scaphoid, lunate, triquetrum, pisiform. So long to pinky. Here comes the thumb. So it will be easy for you to remember. So thumb is attached or articulates with your trapezium. So you will know that it is at the thumb side. So because trapezium has M, the thumb. Then trapezoid, trap. So may P tayo dito, that is trapezoid capitate. Okay, cap, trap. Magkakaiba lang trapezium, may M, so thumb. Trapezoid capitate. Yung triquetrum naman, so try for 3, that is number 3 in our numbering kanina. So 1, 2, 3. So long to pinky, here comes the thumb. So whatever suits you, as long as it can help you recall the 8 carpal bones, that is fine. Okay, so next we have here the anatomic snuff box. So it is a triangular depression located on the posterior surface of the wrist. Ito siya. So may pag sinabing depression, 'di ba? Parang hollow siya, may hollow portion ito. Ito din, mas prominent. So I will erase that para makita nyo. So it is a triangular depression located on the posterior surface of the wrist. It is visible when the thumb is abducted. As you can see, naka-abduct ang thumb. Ito, mas makikita siya. You can try it now. You abduct your thumb and then you see your anatomic snuff box. This is formed by the tendons of the two major muscles of the thumb. It overlies the scaphoid bone and the radial artery, which carries blood to the dorsum of the hand. So, ang purpose, bakit ganyan yung itsura niya, dyan dumadalo yung supply ng blood sa dorsal part ng hand. So, what is the importance of anatomic snuff box in radiography is that if the anatomic snuff box is tender, kapag na-press mo siya tapos tender siya, so this means that there is a fracture with your scaphoid. Okay? Kapag masakit siya, kapag pinress mo siya, tender siya, so meaning that it suggests that there is a fracture of your scaphoid. Ito siya, pinipress siya to check if there is a scaphoid fracture. So, yan yung importance ng ating anatomic snuff box. Okay, so we are done with the anatomy. So, we will proceed with the different uh, positions, projections, and methods that we perform when we examine the first to fifth digits as well as the carpo-metacarpal joints. So we will start first with the second to fifth digits. So these are the most common projections performed, the PA projection, lateral position, either lateromedial or mediolateral. So when we say lateromedial, so this is a position meaning the lateral portion of the digit. If you can recall, again, I hope you can recall your lateral and your medial side based on our anatomic position. So the lateral portion is near the table. Pag medyo lateral, the first one, this is near the table. Okay? And also, we have the PA oblique projection. Okay? So, let us discuss first the PA projection. PA meaning postero-anterior projection. So, when again, to recap, your projection is the direction of your central ray or your path of your central ray or the path of the X-ray beam. So the hand and forearm must be in the same horizontal plane. So you need to flex your elbow. So the patient needs to flex the elbow para comfortable yung patient. Hand must be pronated. So naka-prone yung hands, extending the fingers. So again, we are talking of the second to fifth digits. Align the long axis of finger to the long axis of the cassette. Always separate adjoining fingers from the affected finger to prevent overlapping of adjacent structures. So central ray, perpendicular. So when we say perpendicular, so it is 90 degrees. Okay? Hindi ko ma hindi ko ma-straight yung aking line. So this is perpendicular. Perpendicular. Okay? Pag sinabi naman nating eggshell, 'di ba? More than 10 degrees. So pag tangential naman, so parang dito lang siya. Parang scheme. Okay? I hope you remember those terms. Sige, so let's continue. So the central ray is perpendicular to the pip joint of the affected finger. So in this case, the affected finger is the second digit. So ang central ray is at the perpendicular to the proximal interphalangeal joint of the second digit. So perpendicular, walang angulation. Okay? So again, as mentioned here, always separate adjoining fingers. So dapat separated siya. Ito yung affected finger natin para hindi mag-overlap yung structures. Or halimbawa, yung ating third digit. So yung ating central ray is perpendicular to the third pip joint. So again, if during the exam or class, if I will be asking about central rays, pag sinabi kong what is the central ray of the first digit PA, second digit PA projection. So wag niyo sabihin na pip joint. So dapat kompleto. Perpendicular to the pip joint of second digit or perpendicular to the pip joint of the third digit or kung ano yung part ng digit na sinabi ko. Okay? So, dapat kompleto. So, the PA projection of second, third, fourth, or fifth digit is usually performed to evaluate trauma, also to evaluate joint diseases like osteoarthritis, gout, and osteoporosis. This also best demonstrates fractures or dislocations of the phalanges and distal metacarpals. So sometimes may modification. So instead of PA, the projection is AP. This is for suspected joint injury. Okay? So for fractures or dislocations, so PA projection. For trauma, PA projection. For joint diseases, PA projection. So for suspected joint injury, so we perform AP projection. So dahil naka-PA ito, so baligtarin lang natin. Nakasupine naman yung hand para maging AP siya. So, ito yung ating pip joint. So, dito perpendicular, halimbawa. So, next is the lateral position or the lateromedial or mediolateral position. So, hand and forearm in the same horizontal direction as film. So, basta i-make sure lang natin na komportable yung patient or the patient can tolerate the position. So, hand must be in lateral position. For fourth or fifth digit, so kung ang ating i-expose is either fourth or fifth digit, or your ring or little finger, the ulnar side or the medial side is near the table. So, we follow the medyo lateral position. Pero, if you are going to examine the second or third digit, the radial side or the lateral side must be down. When we say down, near the table. So this is for lateromedial. This is for medyo lateral. So if you try to position your hand, so mas madali siya for patient. So again, fully extend the affected finger para iwas ang superimposition. Central ray, the same pa rin katulad ng ating PA projection. So perpendicular sa pip joint, kaya lang nakalateral lang yung ating digits. Also for trauma, for joint diseases, best demonstrates also anterior or posterior displacements of the joints or the phalanges. And for foreign body localization. So kanina, ang ating AP for suspected injury. So yung ating lateral is for foreign body localization. So ito siya. So ang ating area of interest is the second digit. So as you can see, the radial side is down. So yung radial side niya is down. So for the third digit, so radial side din. So if we are going to examine the fourth or fifth digit, so para maiwasan yung magnification dahil masyado na siyang malayo sa at kapag ganito pa rin yung position ng patient, tapos yung ating area of interest is fourth or fifth finger, malayo na siya sa ating film or sa ating cassette, so there will be great magnification. So ang gagawin natin, so we will reverse the position where the ulnar side here, the ulnar side will be near the cassette. Okay? Sige. So I hope that is clear. Next, for PA oblique projection. So hand and forearm, the same horizontal plane as film. Pronate hand with fingers extended. So naka-prone ang hand with fingers extended. Then oblique hand from prone towards the lateral. So kung naka-prone yung patient, then mag-oblique ka lang. So you pronate your hand towards the lateral side. The metacarpal joint forms a 45-degree angle with plane of the image receptor. So may picture ako dyan para mas maintindihan nyo. So some radiographers rotate the second digit medially from the prone position. So kung naka-prone siya, i-rotate medially towards the medial side. The advantage, so ito, kapag medial rotation, the advantage is that the part is closer to IR, so increased visibility of the fractures and also decreased magnification. So again, kapag ang ating part to be examined is near the IR or closer to IR, ma-decrease ang magnification. So, ito, yung picture natin dito. So, pronate hand towards the lateral side. So, ito siya. So, lateral side. So, yung option naman, pwedeng from prone position, rotate naman medially. So, mas maganda raw ito because the part will be closer to the IR. So, mag-i-increase ang visibility ng fractures. Also, ma-decrease ang magnification. So basta digit, second to fifth digit, the central ray is always the same, perpendicular to the pip joint of the affected finger or the pip joint of the second digit, third digit, fourth or fifth digit. So the same also for trauma, joint diseases, for fractures or dislocations of phalanges and distal metacarpals. So, yan lang sa ating second to fifth digit. So, we have PA oblique. So, may modification. Pwede siyang ma-AP for foreign body localization. And then we also have the lateral, medyo lateral or lateromedial. Then we have the PA oblique projection. So next, we will discuss the different projections or methods naman for the first digit or the thumb. So we have the AP projection, lateral, PA oblique, and the PA projection folio method. For AP projection, place hand and forearm in the same horizontal plane, flex elbow, para comfortable si patient, have the patient turn the thumb and hand in extreme internal rotations with fingers extended. So, align the long axis of thumb with the long axis of the cassette para hindi siya makat off. Have patient hold the extended fingers away from the thumb para iwas superimposition. Central ray perpendicular to the first MCP joint. So, tandaan, central ray for second to fifth digit is the pip joint. JT yan JT, pip joint of the affected finger. Pag first digit naman, ang central ray is sa first CMC joint. Ay, sorry. First MCP. MCP. Hindi CMC. Iba pala yung CMC na examination. First metacarpophalangeal joint. So, yan na. So, as you can see, ito siya. So, have the patient turn thumb. So, naka-extreme hanggang sa makaya ng patient. Extreme internal rotation with fingers extended. Ito, naka-extend siya. So, long axis of the thumb to the long axis of the cassette. So, tell the patient to hold the other fingers para hindi siya mag-superimpose sa thumb. Then, the central ray must be perpendicular to the first MCP joint. Okay, so we have here the first MCP joint or the metacarpal joint. Metacarpal joint. So, ito yung ating central ray. So, perpendicular lang siya. So, for example, I have here so this is the extreme internal rotation that I have explained earlier. Yan, extreme internal rotation. Okay? So, and then we have here the central ray. Dito sa portion na ito. Okay? Okay, so next will be the AP projection. So, sa AP projection, si Lewis nagsuggest that the central ray must be angulated from 10 to 15 degrees towards the wrist to clearly demonstrate the first metacarpal free of soft tissue of the palm. Kasi kanina, kung perpendicular lang siya sa MC joint. So, pwedeng yung ibang part dito ng ating palm, eto, pwedeng mag-superimpose sa ating joint dito. So, ang sabi ni Lewis, so mag-angulate daw tayo ng central ray 10 to 15 degrees para ma-demonstrate ang ating first metacarpal free of soft tissue. Okay? So, common indication is trauma. So, piniperform ang AP projection to assess possible trauma sa first digit. Also best demonstrates the first metacarpal for ruling out Bennett's fracture. So Bennett's fracture is the most common fracture involving the base of the thumb. This is the most common fracture sa base of the thumb, ang Bennett's fracture. This occur when the thumb is forced backwards and towards the wrist. Okay? So, nag-occur ang Bennett's fracture when the metacarpal bone sa thumb side breaks and dislocates papunta sa base of the thumb. So, para ma-evaluate ang Bennett's fracture, so we perform AP projection of the first digit and also following the central ray recommended or suggested by Lewis. So instead of having it perpendicular to the first MC joint, so we angulate the central ray by 10 to 15 degrees para free siya from superimposition of the soft tissues of the palm. So, yan. So, if you have noticed, hindi na siya perpendicular. Di ba? Pag perpendicular, so, eto lang siya. Hindi naman perpendicular ang drawing ko. So, basta, perpendicular 90 degrees. Ewan ko pa bakit hindi ako eto. Ito siya. Perpendicular. So, eto, naka-angulate na siya by 10 to 15 degrees. So, ito yung Bennett's fracture. So, yung metacarpal bone, nag-dislocate siya papunta sa base ng thumb. Ito. Para nakasiksik na dito yung metacarpal bone na fracture. The next, we have the AP projection. So, this is the modification of the PA projection wherein the hand is in lateral position. Rest the elevated and abducted thumb on a radiographic support and the dorsal surface of the first digit must be parallel with the IR. Central ray is perpendicular to the MCP joint to the center of IR. This is performed, ang PA projection is performed kung hindi kaya ng patient ang AP. Halimbawa, masakit, hindi niya ma-tolerate dahil sa fracture or dislocation, so we perform the PA projection. This is not advisable, kaya lang hindi siya advisable because of the loss of definition because of the increase of ID. So, magiging malayo na yung ating first digit sa ating IR. So, magkakaroon ng magnification. So, hindi na siya ganun ka ganda yung kanyang visibility. So, kaya lang wala tayong magagawa if hindi kaya ng patient yung AP projection. So, central ray, the same pa rin. Yung position lang yung nag-iba. So, perpendicular to the first MCP joint. So, ito siya. So, as you can see, may distance, may gap. May gap na between the finger, between the first digit and the IR. So, magkakaroon ng magnification. So, again, piniperform lang natin ito kapag the patient cannot assume the AP projection due to so much pain or because of the dislocation. So sometimes pwede ring lagyan siya ng sponge, radiolucent sponge para komportable sa patient. Pero ganun pa din, there will be increased in OID. OID is the object to image receptor distance. So next is the lateral projection. So place hand and forearm in the same horizontal plane as film. Flex the elbow comfortably and pronate the hand. So naka-prone, align the long axis of thumb with long axis of cassette and have the patient arch or cup the hand and abduct the thumb until the thumb lies in a lateral position. So later may short clip ako dyan on how to perform this instruction. If the patient is not able to perform the instructions here, so we can abduct the thumb and elevate the hand and fingers until the thumb is in lateral position. So, yun nga, kaya yung mga rad tech madiskarte kapag kasi hindi makuha sa recommended position, pwede tayong gumawa ng ibang way. Then, support the elevated hand and fingers with a sponge or radiolucent sponge or other suitable immobilization device. So, the same pa rin ang central ray, first MCP joint, perpendicular. So, tandaan lang, yung kay Lewis lang kanina, yung may angulation na 10 to 15 degrees. So, again, this is performed to evaluate trauma. And the thumb has several unique fractures that require modification in positioning. So, kaya hindi nasali yung first digit dun sa na-explain natin kanina. So, yung first na group is second, third, fourth, and fifth digit. And then, meron talagang sariling projections para naman kay thumb. So, again, because it may acquire several unique fractures that require modification in positioning. So this is a routine projection of the thumb. So ito siya. Ito yung sinasabi ko na i-arch ang hand hanggang sa hanggang sa maglateral yung ating thumb. So, you may watch the clip here. Teka lang. Ito siya. So, notice yung pag-iba ng position ng thumb. Kapag ito yung position ng thumb, so yung ng ating hand, kapag naka-prone ang ating hand, as you can see dyan sa short clip, ito. So, ito ha, naka-prone ang ating hand. So, yung ating fingers, second to fifth, naka-prone din. Ito yung ating thumb, naka-oblique. Okay? So, again, when the hand is pronated, kapag naka-prone ang hand, second to fifth digits, prone din. Pero yung first digit, naka-oblique. Okay? So, can you see it? Naka-oblique siya. And then, kapag unti-unti kong isinara yung aking second to fifth digit, so look at how the position of the thumb changes. Erase ko lang yung ink. Yan. So, naka-lateral na siya. So, abduct it. So, ito, abduct the thumb and elevate the hand and fingers para mas maging lateral pa yung ating thumb. Again, yan. Tapos abduct lang siya. Nakalateral na siya ngayon. Okay? So, I hope mas clear siya. Okay. So, another one. So, abduct lang siya. So, again, abduct the thumb and then elevate yung fingers and the other parts of the hand. Tapos, lagyan lang siya ng support to ensure na nakalateral yung thumb. So, kanina, sorry. So, kanina, sa first na ginawa natin, ginawa ko pala. So, nakakap yung hand hanggang sa maglateral. So, kapag hindi kaya yun ng patient, na i-cup yung kanyang hand, so pwede ding i-abduct yung hand and then elevate na lang yung fingers hanggang sa maglateral yung thumb. So, again, ito yung first. So, i-cup yung hand para mag-lateral yung thumb. Ayan. Abduct lang siya para walang superimposition. Ayan. So, kapag hindi kaya ni patient na i-cup yung kanyang hand, pwede naman ganito lang. Abduct the thumb, then elevate lang yung hand. Hanggang sa maglateral yung thumb. Central ray, the same pa rin, perpendicular to the first MCP. Okay, so I hope that is clear. Next, the PA oblique projection. So, the same instruction, flex elbow, place palmar surface of hand on cassette. So, naka-prone yung ating hand kasi PA. Abduct thumb and place on cassette in 45 degrees oblique position. Align the long axis of thumb. Central ray, the same pa din, basta the first digit, first MCP joint. This is also for trauma. So, the same rin requires modification in positioning, routine also. So, ito siya, PA oblique. So, simple lang. Yun yung sinabi ko kanina, naka-prone yung ating hand, automatic naka-oblique na yung ating thumb. Wala nang ibang gagawin pa. Prone lang yung hand, ilayo lang yung ibang fingers, yung second to fifth fingers, para makita yung ating thumb. Automatic, naka-oblique na siya. Ito. So, wala nang superimposition. Then, yung ating central ray, ito yung crosshair. Dito siya sa first MCP joint. Okay, ito yung kanyang central ray. Dito. First MCP joint. Okay. So next, the PA projection folio method. So this is the patient-controlled stress radiography of the thumb. Tinawag siyang controlled stress radiography because naglalagay tayo ng object para ma-stress yung thumb. So, bali, sa folio method, bilateral siya, meaning dalawang thumb. Siyempre, right and left thumb ng fingers. So, para maintindihan, eto siya. So, position both hands side by side to center of cassette rotated laterally into 45-degree oblique position. Yung hand, naka 45-degree oblique position so that yung ating thumb ay through PA. So, kailangan naka 45 degrees lateral rotation yung ating hand para yung ating thumb ay naka PA. So, maglalagay tayo ng object. We call that a round spacer. So, anything basta round between the proximal thumb regions. Then, wrap the rubber bands around the distal thumb. So, yung rubber band, yung magsisilbing stress ng ating thumb. Before exposure, ask the patient to firmly pull the thumbs apart and hold. So, parang magta-tug of war yung dalawang thumbs niya. Central ray, So, sa MCP joints pa rin, kaya lang dahil dalawang thumb, so sa gitna lang. So, midway between both hands sa level ng MCP joint. Sa level na kasi dalawang thumb na siya. So, this is useful for the diagnosis of the ulnar collateral ligament rupture or the UCL rupture in the MCP joint of the thumb. So, yung other name for UCL or ulnar collateral ligament rupture is the skier's thumb. Yung mga ng mga nagsiski. Wala namang ski dito sa atin kasi walang snow. Skier's thumb is caused by falling on a hard snow surface with a ski pole in hand. May picture ako dyan later. So it is also known as gamekeeper's thumb or skier's thumb or the UCL tear or the UCL rupture. Ito siya. So yung mga gamekeeper dun sa mga hindi, baseball ba yon? So, pwede silang magkaroon ng gamekeeper stamp. Hindi na skier stamp ang tawag doon. So, ito siya. So, lagyan ng spacer. So, any round spacer. And then, lagyan ng rubber bands dito sa distal portion. Then, sabihin kay patient na i-pull yung rubber band ng kanyang thumb. This side, yung pinaka-tolerate niya. Ito, kaya nga stress radiography siya. So, ito yung magiging itsura niya sa radiograph. So, yung central ray is, di ba kapag isa lang, yung central ray is dito. But since dalawa, so midway, dito sa gitna lang at the level pa rin ng MCP. Ito siya. So, sa level dito. So, yan yung Folio method or patient-controlled stress radiography of the thumb or PA projection. So, ito yung skier's thumb. Ito, kapag na tumba siya, falling on a hard snow surface while holding the pole of the ski. Ito. So, yung ulnar collateral ligament rupture or injury or the skier's thumb or the gamekeeper's thumb. Okay, so we are done with the first digit, second, third, fourth, and fifth. So next, we will discuss the first CMC joint radiography. So it was suggested by Robert, who first described the radiographic position of the first CMC joint in 1936. Then, in 1988, nag-modified si Lewis ng central ray. Then, Long and Raffert further modified it in 1995. So, nag-iiba ang examination sa first CMC joint, nag-iiba sa central ray. This is commonly performed to demonstrate arthritic changes, fractures, displacement, or dislocation of the first CMC joint as well as the Bennett's fracture. So, the examinations also include AP projection or the Burman method. Sige, so AP projection, Robert method. This is, si Robert, this is for the first CMC joint. So, patient seated at the end of the table and extend the limb. Extend yung kanyang upper extremity. Patient should be low enough to place the shoulder. Pakita ko na lang yung picture para ma-imagine nyo yung sinasabi ko. Ito. Patient should be low enough to place the shoulder, elbow, and wrist on the same plane. So, dapat straight siya. The same plane to prevent elevation of the carpal bones and also to prevent closing of the CMC joint. So medyo complicated and medyo mahirap para sa part ng patient ang pagposisyon nito. Rotate the arm internally to place the posterior aspect of the thumb on the IR. So dapat yung posterior aspect ng thumb nasa IR. So meaning naka-AP siya, 'di ba? AP. Rotate the arm internally to place the posterior aspect of the thumb on the IR. Then, hyperextend the hand. Ito, naka-hyperextend siya. Ito, hyperextend. So, ang purpose niya is that, so that is for the soft tissue over the ulnar aspect does not obscure the first CMC joint. So, ang purpose niya lang, bakit kailangan i-hyperextend yung hand, ito, ilayo siya sa thumb para walang superimposition. So, Long and Raffert state that the patient may hold the fingers back with the other hand. So, nagsuggest si Long and Raffert na yung isang kamay ng patient, pwede niyang hawakan yung other fingers to ensure na hindi siya mag-superimpose. Or yung iba, kasi mahirap naman talaga para sa patient ito, so naglalagay sila ng tali or ng cloth, lalagay dito para hawakan ng patient para ma-ensure na naka-superimpose, para ma-ensure na naka-hyperextend yung kanyang mga digits, second to fifth digits para walang superimposition. So the central ray for this, according to Robert, perpendicular lang sa first CMC joint. So parang kasama rin siya sa thumb. Pero yung kanyang focus talaga is the first CMC joint. So kay Robert, perpendicular. Kay Long and Raffert, 15 degrees proximally. And kay Lewis, 10 to 15 degrees. So katulad ng na-discuss natin kanina. So again, the same lang ang procedure. Sa central ray lang nagkakaiba sa first CMC joint. Si Robert, perpendicular. Long and Raffert, 15. Lewis, 10 to 15. So the purpose of the angulation, bakit na-angulate? It may help project the soft tissue of the hand away from the first CMC joint para walang superimposition. Also to open the joint spaces na hindi gaanong makita kung naka-perpendicular ang central ray. So to open the joint spaces and to avoid superimposition. So yan yung mga purpose ng pag-angulate. So again, to recap, so ang purpose ng angulation is para ma-avoid ang superimposition as well as to open the joint spaces na hindi makita sa perpendicular na central ray. So again, na-discuss na naman natin yung mga purposes kung bakit tayo gumagamit ng angulation. So to continue, so AP projection kay Robert, ito siya perpendicular to the first CMC joint, CMC or the metacarpal joint. So yung ating sa thumb is first MCP, dito siya. Ito sa CMC, dito naman sa first CMC joint or the metacarpal joint. So kay Long and Raffert, 15 degrees ang recommended. Kay Lewis, 10 to 15 degrees na central ray. Okay? So best demonstrate is location of the first CMC joint, yung kay Robert, with modification ni Long and Raffert and Lewis. Also best demonstrate the base of the first metacarpal for ruling out Bennett's fracture and to demonstrate arthritic changes and fractures. So, tandaan nyo lang kasi ilang beses na rin lumabas sa board exam itong sa first CMC kay Robert, Long and Raffert, and Lewis. Then last for the CMC is kay Burman. So AP projection, Burman method. So place the IR under the wrist and center the carpometacarpal joint to the image receptor. Hyperextend the hand and have the opposite hand hold the position or with a bandage looped around the digits. So may picture din ako dyan in a while. Rotate the hand internally, abduct the thumb so that it is flat on the IR. Kasi naka-AP siya. Central ray is 45 degrees towards the elbow. So may angulation siya or proximally, 45 degrees proximally or 45 degrees towards the elbow at the first CMC joint. So ang purpose naman ni Burman to provide a clearer image of the first CMC joint as compared dun kay Robert. So, best demonstrate a clearer image of the first CMC joint than the standard AP projection. Yung standard natin yung kay Robert. Base also shows that the base of the first metacarpal is in convex profile. Also, trapezium is seen in concave. So, yan yung kay Burman. So, hyperextend the hand and then rotate it medially para mas mag-AP yung ating thumb. And then yung central ray niya, ito, 45 degrees towards the elbow or proximally. Dito papasok. So, yan kay Burman. So, mas clearer daw yung image ng first CMC joint kay Burman compare kay Robert, kay modification ni Long and Raffert, and ni Lewis. Kasi 10 to 15 lang sila. Ito, 45 degrees. So, mas clearer daw ang image ng first CMC joint. Okay, so that will be the end of our discussion for the digits.